Welcome to the Fabulous Women Podcast Studio. I'm your host, Kim Allen, and we have a great episode today. They're all great episodes. This one is especially great because we're going to be talking with a wonderful young woman who straddles two worlds. What? Who does that? She does that. She does it so well. I want everyone to please meet my guest. This is Laura Mauro. She's a PharmD. We talk a lot about STEM in my episodes, and Laura has such an incredible story to talk to you about. The title of this is really cool. It's From Canvas to Care, How Laura Mauro, PharmD, designed a life of precision, purpose, and patient advocacy. Wait till you hear this. Okay. So first of all, Laura, welcome to the podcast. I'm so happy you're here.
I'm so happy to be here. Thank you for having me.
Are you kidding me? You're the best. Okay. So we have a lot. This is a little bit different for me because I usually open up with a bio. And is that okay if we start there, Laura?
Absolutely.
Okay.
Absolutely.
So Laura's bio is going to actually unfold to a couple other surprises here, which is going to be really, really interesting. So I want to read her bio because I never memorize this stuff. You know what? I want to let everyone know. I always like to set the stage for my audience, and I can't memorize this type of brilliance. And if I did for all my podcast, I just can't do it. I don't want to do it. All right. So Laura Mauro, PharmD, she is a clinical pharmacy leader with a large integrated health system where she advances pharmacist-led care through innovative physician-pharmacist collaborative practice models. With more than a decade of experience in ambulatory care and diabetes management, she has helped design and scale programs that improve clinical outcomes through medication optimization. Her path into STEM wasn't a straight line. Before entering clinical pharmacy, Laura began her academic career journey as a fine art major at an all-women's art and design college, an experience that continues to shape her creative, patient-centered approach to problem solving and leadership in STEM. A passionate mentor and educator, Laura is deeply committed to supporting women in healthcare. All right. So that's a lot, but I'm not done. Okay. So I actually had a promotion written for Laura, and I did put some of it on social media, but I'm going to read it for this audience because, again, it's so fascinating that with Laura, her brilliance doesn't require a straight path. It requires self-trust. So with Laura, with a full scholarship to an elite art college in Philadelphia, Laura made a decision that surprised everyone. She walked away, not because she failed, but because she listened. She pivoted into pharmacy, excelled in one of those most demanding academic disciplines, and today leads her own practice supporting 20 physician offices, which is over 100 physicians that live across all the offices, if you will, while remaining fiercely patient-centered, deeply ethical, and profoundly human in her work. In this episode, Laura shares what it really takes to build a meaningful career with discernment, discipline, and resilience, and the courage to redefine success on your own terms. And she absolutely did that with her own terms. And I'm not finished, everyone. Okay. I'm going back and forth because she actually has a couple things I wanted to read up front. One of them was a quote from her. And I'm hoping that, well, I know that we're going to be talking about this in the episode, but I really want to set the stage with two things that she has said. One is the moment I stopped trying to justify my choices to other people was the moment my career truly began. That's really, really powerful. And you did this as a younger woman, and you're already young. And I'm also going to, before we get to the questions, is I want to actually read what her advice is to women building careers in STEM. This is going to be overarching for all of the questions and her answers. And this is per Laura Mauro. Trust the expertise you've earned. Speak up and remember that your perspective might be exactly what the team needs. While my career sits in STEM, the arts are what helped me design care that actually works for real patients. Okay. I don't know about all of you. I am I am so curious to find out how all this came about. So, Laura, are you tired of hearing about yourself? You shouldn't be, because we're going to keep talking about you. Okay. So, before we begin with the questions, do you have anything you want to add or anything you want to say?
I just want to say thank you for that lovely introduction. I feel like I'm blushing. That was so sweet. Thank you. I'm so excited to be here.
Well, Laura is very humble, and I'm telling you, she is so smart. She's wicked smart. She is so smart that I feel like I need to re-enroll kindergarten again. All right. All right. So everyone knows me that I put my questions into different buckets because, again, I want everyone to know where I'm going with all of this so that you take as much out of this episode as possible. So we're going to be starting with the opening questions regarding origin and identity. So, Laura, you began with a full scholarship to an art college, something many people would never walk away from. What did you feel in your body or intuition that told you this isn't it?
Yeah, so I started my education at an all women's art and design school, and it was all art all the time, which was amazing. And I loved it. But once I was in that world, I missed science, I missed math that I had had all through elementary and secondary education. And so I learned, you know, you're allowed to have other passions, right? You can be passionate about other things, and you're not supposed to have it all figured out at the age of 18. I
Right.
think we we think we're supposed to, but you're allowed to have other passions, and that's
Yeah.
okay. And so I
Yeah.
really was like, you know what? This isn't it. This isn't it. I wanted to do, while I love art, I wanted to do something that had a more like direct impact on patients.
Mhm.
And so I pivoted, and here I am.
It's, that's so brave to do that.
Mhm.
And first of all, when I was 18, when I was in college, I sat through courses for my major, and it was the first day, and I was like, I hate this. And I switched my major, and it was still in business though. But I really was brave to do that because
Yes.
I went to St. Joe's, and you just don't do that, and I did. And I think when I was 18, the most important thing to me was what I was having for lunch. So again, for anyone to figure out what they like, these folks, they're like, I knew when I was 9 years old that I
Oh my
wanted,
gosh.
right?
Mhm.
I'm like,
Mhm.
who are you? Okay. I think the most of us out there really don't know what we don't know. And sometimes we don't know what we want until we try other things. We're like, yep, that's not it.
Mhm.
So, my second question for you, Laura, art and science are often framed as opposites. So, looking back now, how did your artistic training actually prepare you for pharmacy and patient care?
That's a great question. Um, I think when I chat with people, especially in STEM, medicine and science, I always tell them art school is so much harder, just from my personal experience, so much harder than any science degree, any medical degree, right? I have a bachelor's in biology, I have a doctor in pharmacy. Art school, hands down, hardest, right?
Wow.
You can't just walk in art and design school and go to a lecture, memorize everything, come take the test, ace it, and walk away. You have to conceptualize, you have to design, you have to, you're often critiqued, right? And you have to critically think and look at little nuances in your art. And I think that really helped me when I switched paths and I went into science. Um, all of my training from art school to critically think, to look at patients individually and see those little nuances, that was they mesh so well together, but you don't always think that.
Right. Oh, I love that. I think that is so cool. So, what did it cost you emotionally or socially to change direction so early and so boldly?
I think emotionally for it was a lot emotionally for me.
Yeah.
I felt like I was letting a lot of people down for some reason. All these people who were so excited that, had
Yeah.
followed my art career,
Hmm.
and I felt like, "Oh my gosh, I'm letting everyone down. They really believed in this version of me, and I'm just walking away from it." So emotionally, that was a lot. Um, and I'm sorry, what was the second part of your
Well,
question?
no, it was what did it cost you emotionally or socially to change directions so early and boldly? And actually, I want to add to that. What did it give you? Because again, you were young to do that. So I mean, you're talking about the fact that, socially and emotionally that you were letting other people down.
Right.
The cost was to you.
The cost was to me, I think what it gave me, honestly,
Mhm.
was now looking back on it,
Yeah.
and which I still have, is the confidence
Yeah.
to change course,
Yep.
right? Back then, maybe I didn't have that, but now I'm confident. I know that I can pivot and change course and everything's gonna be okay, maybe
Yeah.
even fabulous.
Well, it is. You are fabulous. Well, I appreciate that because my husband and I, we have a daughter who went to art college. And if anyone knows, or if you don't know anything about art colleges, they're very expensive. And I still remember our daughter went to a all girls college prep high school. And I believe that our daughter is the only one out of all of them that went to an art college. And I remember the mothers coming up.
Wow.
Yeah, I remember they were all sitting on stage and they stood up and said that where they were going. And I had a couple of these mothers that came up to me and they were actually talking like this, like, I can't believe that you let your daughter go to art college.
Oh my
And I was like, well, why are you talking to me like that? First of all, but number two, it was really interesting to watch some of the other people who were following mommy and daddy's footsteps of going to law
Mhm.
school or
Mhm.
medical school, and they never made it, or they did and they left it. It's very interesting. And our daughter, you know what, everyone, I'm looking in the camera, she got a job and she's actually benefiting from her college education in art. So, right?
I
People don't,
love that so much. They don't get it. Nobody gets it.
no one gets it. They really don't. And then really, again, I know that Laura is like genius level smart. She's going to hate me saying that, but she is. But again, this is a woman who is so smart. And she went from art college to pharmacy. I can't even spell pharmacy. I think it starts with an F. I'm not sure, but right. So at the end of the day, it just goes to show you how hard art really is, because when they're talking about in the world, like, oh, you can outsource accounting, you can outsource the sciences, you can outsource anything, nurses, whatever, but you can't outsource artists.
So true.
Right? Is that true? So
100%.
yeah. So thank you for letting me know that all the money that we spent as an investment,
Aw.
it paid off, and we are so proud of her. And
Aw.
yeah,
I
I'm
love
so
that. Mhm.
so proud of you. All right. So we're going to be moving on to the next section of questions,
Okay.
which again, is that the discipline and your grit, if you will, and the mastery. So pharmacy school demands precision, endurance, and discipline. What surprised you most about yourself once you were in that world, coming off of the art world?
I know, it's a big jump. I think what actually surprised me most once I was in pharmacy school is how much I was actually using the creative side of my brain. Because you don't think of that, right? You think you're gonna be using, like, the science and all of that, and
Right.
I actually was using this creative side of my brain, right? So I'm designing and optimizing medication regimens.
Right.
And, to bring it back to art school, really, in art school, when you're working on something, you're working on it until it makes sense, right? You're tweaking this depending on what medium you're using. You're working on it till it makes sense. And it's really the same in pharmacy. When you're doing med regimens and working with a patient, it's just like a different set of tools that you're
Right.
using, but it's the
Right.
same concept. And so I think that surprised me a lot. I'm like, "Oh, I can really use my creative side here in science."
Wow. I would never think that.
I
I came,
know.
I came from the pharmaceutical world, and I was a drug rep. I worked in physician offices. I worked in hospitals, and never once ever did I think with science that I could be creative. I was creative in how I approached my clients, right? But
Mhm.
when I spoke about the drug or the product that I was selling, it never occurred to me about making that creative. It was how I communicated with them that was creative. So listening to you is like it's a learning experience for me, Laura.
Oh.
I love that. Yes. All right. So many women underestimate the capacity for rigor. Would you say that a woman who is afraid she's not cut out for demanding science, what would you say to a woman, excuse me, who's afraid she's not cut out for a demanding scientific or medical path?
First, I would tell any woman that they can do anything. They
Yes. Thank
absolutely can
you.
do anything, right?
Yes.
Um, I would tell them to, if they don't think they're cut out for that path, but they're looking into STEM, show up, ask questions,
Mm,
um, build your skills, a
yes.
little at a time.
Yes.
And women are needed in STEM. Our voices are needed in STEM.
Okay.
We're necessary. So um, I would tell them that, they don't need to see the whole staircase to take the
Mm,
first step. How's that
right.
one?
Yeah, I think you know what? That's a great visual. I'm a highly visual person. And that's
Mhm.
how I felt sitting through my classes the first day at St. Joe's, because I was looking at the staircase. And when I really was standing on the first step, but I did look up, I'm like, yeah, no. So I just switched to just one other part of the business programs that they had. So it actually worked out great for me. But I do think though that because it's a matter of the view that you have, that you're either on that or you're looking at the first step. And sometimes if we are changing our view to looking at the top of the staircase, that can be overwhelming. We're not
Totally
prepared,
overwhelming.
right? You can't go from the bottom step to the top of the staircase. You have to walk up the different
Yeah,
steps. And I think that's what part of that fear is also. It's always that F word, like the fear that, again, that women actually think that they're not cut out for it. Are you kidding me? Hey, everyone, if you're listening to this young woman who is brilliant and has an incredible career, she's saying, don't be afraid of that. And that STEM is very necessary for women. So we've got to keep that message going. And thank you for saying
absolutely.
that. Okay. So was there a moment in your education, Laura, or early career when you realized I'm really good at this,
In pharmacy.
or art?
Oh. Well, I think in pharmacy, I realized I thought, oh, I'm really good at this. I think once you start leaning into your expertise, right? So as a pharmacist, you are the medication expert on the team.
Right.
And so you understand medications at like a molecular cellular level.
Right.
And there's I actually brought this up so many times before. There's a quote, I don't know if it's Einstein, I think they attribute it to him, but it's something along the lines of, if you can't explain something simply, then you don't know it. I'm going to butcher it like deeply or something. But
Yes.
I think it's so true because I'm able to have a conversation with a patient and very simple explain an extremely complex
Yes.
medical scenario, medication, and they're like, "Oh, I finally get why has no one ever explained it like that to me before? I finally get it."
Yes.
And so when I hear that from a patient like, "Oh, I get it." I'm like, "You know what? I think I'm
Wow.
pretty good at this." But you really have to understand it at such a scientific level to be able to explain it simple. If you don't know, it that
Right.
deep, you can't explain it to a patient.
That is so important. I'm pointing to, okay, everything's backwards here. I'm pointing to my book, Reengage, because it's actually that intentional engagement. I actually have a chapter on that about keeping things simple, because let's face it, we're in a world of, I mean, let's talk about STEM, right? It's science, it's technology, it's engineering, it's math, it's medical. And those are concepts that are not always evident to the average bear.
Mm-mm.
But yet some folks they'll go right into engaging at a level that no one understands. And that's why, and because even I was in pharmaceuticals, is so weird. I don't speak science, yet I was really successful, and I still can't figure that one out. But the point is that I didn't speak their language because I on my own started making things simple. And I actually had to go in with studies. What? I mean, this is before like my master's or my doctorate. Like, I had no idea. And I'm going in there trying to talk to a physician, probably from
Mhm.
like Harvard or like Dartmouth, whatever. And I'm trying to explain the study to them. What a boob. I mean, I was like, what am I doing? But I actually had the doctors explain the study to me in English, because doctors like
I
to
love it.
they like to teach. And I was like, oh my gosh, this makes so much sense to me
Mhm.
now. But I think it's
Mhm.
exactly what you were just talking about. So
Mhm.
thank you for bringing that up.
Oh, yeah.
Okay, so where am I now? Okay. So my next question again. Oh no, am I in grit still? Oh my gosh. No, now we're talking about building authority without losing humanity. We actually finished that section. So again, you support and advise physicians in 20 different physician practices, a
Mhm.
position of immense trust.
Mhm.
How did you earn credibility in spaces where women are often expected to prove themselves repeatedly?
Oh, great question. Um, obviously, I mean, I have to let the results of my work speak for themselves,
Right.
but, looking back on, when I was early on in my career in healthcare as a clinical pharmacist, a lot of times I would see a lot of projects happening where there was no PharmD, there was no pharmacist, where a
Right.
pharmacist should be and
Yep.
could be. And one of the very first pharmacists I worked with, I'll never forget this. She said, "If you do not have a seat at the table, you're probably on the menu." Me, like, I need to have a seat at that table. So there was no pharmacist sitting at a table in these big meetings, right? Other
Mm,
disciplines from healthcare coming up with programs for patients or whatever. And so I asked for a seat at the table,
mm,
and they
mm.
welcomed me with open arms, and they're like,
Wow.
"Oh, a pharmacist can do this. A pharmacist can do, oh, this is great." But no pharmacist was at the table to
Wow.
have us in projects before. So I spoke up, I asked for a seat at the table. I, was able to talk the talk, from my
Right.
expertise with
Right.
with colleagues, and they gave me opportunities to pilot programs I had ideas for, and then I let the results speak for themselves, and they kind of just
Fascinating.
expand it into where I am today.
I love hearing you say this because when I was back in my drug rep days, I mean, I dealt with a lot of pharmacists. And I don't remember ever seeing female pharmacists. So I'm
Mm,
like, I know that they were, they were going through pharmacy school back then. They weren't PharmDs, but I'm
mhm,
like, where were they? Where were the women? I didn't see them. Now it's a whole different ballgame.
right.
So one thing with you, Laura, that you lead without ego. What is your focus? What your focus on? You focus on patient outcomes, not hierarchy.
Mhm.
So how do you define leadership in healthcare then?
I I think leadership in healthcare is collaboration. Leadership is
Mhm.
collaboration.
Okay.
So, again, looking at a whole healthcare team, if you have one discipline, and oftentimes, and I'm sure you've seen this over your career, people work in a silo.
Yes.
You might have all physicians working together, or all
Yep.
nurses working together, or
Yep.
pharmacists work. They're just in their silos, and they
Yes.
don't know what they don't know. And
Yeah.
so I think as great leadership, when you bring everyone together, patients always have the best outcomes when
Mm.
they get everyone from the healthcare team coming together, highlighting their strengths, and it just works great for a patient. So leadership to me is just all about collaboration.
Yeah. And that's so important because we're, in the work now AI is going to be everything. And I'm reading it over and over and over again that AI 100% still needs human collaboration.
Mhm.
And I love that. I love that that is your mantra. I think it's great. So, what ethical lines are you absolutely unwilling to cross, even if crossing them would make things easier or more profitable?
Oh, I think all pharmacists would say patient safety.
Yes.
Patient safety for me. So it's never to me about more medications, it's about safer medication.
Right.
I love
Right.
to get rid of drugs. Actually, I'm always trying to take things away. Of course, if someone needs something, then I have to add
Right.
it on, but um, making sure medications are safe.
Okay. So, the next set of questions have everything to do with patient care advocacy and impact. So, advocacy is central to your work, obviously, with what you do. How do you balance evidence based medicine with seeing the whole human in front of you? We were just talking
Oh,
about
yes,
this.
that's such a good question. So, I always meet patients where they're at, and especially my practice is mainly diabetes,
Okay.
uncontrolled type 2 diabetes. But I follow evidence-based medicine,
Okay.
and there's evidence-based guidelines out there, and I think the important thing to know is that they're guidelines, they're just guides. They're not some written protocol that you follow to a T. It's a guide. Um, and so when I meet with patients who have diabetes, if anyone listening in knows anyone with diabetes, it's overwhelming. Um,
Yes.
you are now having to check blood sugars. You are having to change your diet. You are
Mm.
having to take medications, a lot of times injectable medications. And
Right.
that's on top of everything else. Maybe you have
Yep.
some other medicines. You have a career, you have a family, you have a life. It's so overwhelming. So I
Right.
always look at the patient as a whole, and how can we make their life easier? How can I get
Right.
rid of medications? How can
Right.
I simplify your diet, or how you're checking anything that I can do to make life easier and to have them feel successful, and almost like the diabetes, I don't even have to think about it anymore because everything's so, like, perfected
Right.
after they're done working with me, so they can focus on other, important things.
Yeah. No, I think that's so true. Can you share a moment with a patient that reaffirmed why you chose this path?
Oh, um, let me think. I think this happens a lot actually, and it always makes me just feel so good inside, because I really feel like I'm helping patients all day, every day in what I do. But, let me think of a patient example. Okay, so patient comes to me. They're on 4 injections a day for diabetes, right? Insulin, mealtime insulin and their regular insulin. That's 4 injections a day, and they're on a pill. a
Mm.
yucky old pill that has lots of side effects. They've been on the same meds for years. Their
Mhm.
physician refers them to me. And they're not injecting at the right time. They're not taking their meds at the right time. Their sugars are kind of a roller coaster. So
Yes.
once I meet with them and I listen to them, that's the most
Mhm.
important, just listening to them.
Mhm.
Patient example, I got them off of all 4 injections. They're no longer on insulin.
Wow.
That yucky pill is gone. I gave them a once a week injection, prescribed it, and blood sugars are perfect. And they just are loving their lives. And it happens so often. And I just adore my patients. They're like, I treat them like family members,
Right.
but that happens a lot. And it just makes me like, oh, you know what? I'm so glad I chose this career and I'm able to
Sure.
help
Wow.
patients.
Well, I'm sure that your patients adore you as well, and all of the 20 physician practices. I'm sure they love you. So, all right. So the final bucket of questions fall under the category of womanhood, motherhood, boundaries, and real life. So you're a mother, you're a clinician,
Yes.
you are a leader all at once. What does having it all actually look like in real life, not in Instagram life?
Oh, it's beautifully messy. Um,
Oh,
right? Not perfect. Lots of calendars and color coded things going on, right? When you're balancing it all. But I have 2 little boys, and I always try to show them, that mommy can be successful in her career and at home, and, I hope that they grow up knowing that women can thrive in everything.
right. And they can.
Yeah,
Absolutely.
yeah.
So what boundaries have you had to put in place, Laura, professionally or personally, to protect your energy and your integrity?
I've had to learn to say no, which was very difficult for me
Mm,
early on in my career, just to say, "Hey, my plate is too full. I can't take
okay.
any more," right?
Okay.
Like, because if I take on whatever you're asking me to do, I'm not gonna be able to give it my best.
Right.
And so when I was young in my career, I was taking it all.
Yeah.
And, it's hard to give 100% in all of these different areas, but especially
Right.
now having children and different things, I you know, I
Yes.
I know how to say no because I gotta make sure that my bucket's, like, full
Right.
to give them things they need to, so.
Yeah. I mean, it sounds like you not only have boundaries, but you have, you prioritize as
Mhm.
well, which is so healthy that you do that. So my final question, Laura, is this. If you could speak directly to a woman standing at the edge of a pivot, unsure, scared, but curious, what would you want her to know about trusting herself?
I think that she should trust, the expertise that she has earned,
Right.
right?
Mm,
You've earned this, you are the expert, trust it and speak up, and especially from a STEM situation, maybe
yes,
your perspective is exactly what everyone needs to hear around the table.
it's true.
Speak up, trust your gut, go for it.
Yeah, it's true. I agree with you. It's a whole different world that women are, they are stepping up to the plate and they're demanding,
Mhm.
thankfully, that they are equal at the table as well, right? That their voice absolutely needs to be heard. So, yeah, no, I just think that having you as a guest, I knew it was so the right thing to do because you're the right woman at the right time with the right
Mm.
message at
Aw,
the right
thank you.
age too, right? Because you're not 20 and you're not 60. So, you fall in that sweet spot that
Yep.
that everyone is pivoting. We need leaders like you, and you're certainly a leader. I just want to thank you so much for sharing everything. I have a whole different perspective now with regard to the arts and to medicine, pharmaceuticals, pharmacy. I never saw the mesh of them, but I not only saw it and felt it from you, but I have a different perspective because of that now. And I'm sure that the audience watching right now, I'm sure that you have as well. So thank you so much, Laura, for joining me. You have to come back at some point.
Oh, I would love to.
Okay. All
Thank you
right.
so much for having me. This was
Yes.
amazing.
Oh, well, what I want to do, and I do this at the end of all of my podcasts for those who know me, who are watching this, who are listening to this, everyone knows that I love women, I support women, and I promote women. And one way that I do that is through my podcast of Fabulous Women podcast studio. If anyone wants to be on an episode, or if they know of someone or more than one woman who really is so outstanding that she's really fabulous at what she's doing, please reach out to me and we can talk about that. Also, I have an ask, and I will never stop asking this. Even on my deathbed, I'm going to be asking this. So please, women, please pay it forward and open the doors for other women to support other women. I see it every day that there are women out there that still do not support other women. I don't understand that. I lose nothing by promoting women. I lose nothing from doing that. You will lose nothing from doing that. And it's going to make it easier for not just women in their careers now, those who are coming up, and those who have been in their careers for a really long time, maybe getting close to the sunset of their careers. We all need to feel that I call it the girl club, if you will. That's a great thing. Not the mean girl club. Okay.
Right.
A whole nother episode, but supporting other women who support other women. I just think that there's special places in heaven or in the universe for everyone who does that. So please, again, pay it forward. Don't make other women kick down doors like we've had to do. It's just so unnecessary in today, our society. Also, I want everyone to watch all of my future episodes and stay tuned, because I got a lot of big announcements with regard to the Dr. Kim approach and also to the Fabulous Women Studio. And finally, I will say this. We've already met a fabulous woman today, Laura Mauro. And until next time, I want all of you to be just like her and stay fabulous. Thank you for watching.